Welcome back to Medquest Digest. This week we got a quick case for you to master that information on the USMLE and COMLEX. I'm Niket Sonpal, and let's get started. You have a 32-year-old male who recently emigrated from Venezuela with severe right lower quadrant abdominal pain upon presentation. He says the pain started around his umbilicus and moved to his right lower quadrant. He's tendered a palpation in the right lower quadrant, and he has a positive Rovsing sign. He has a rash on the palms and soles of his hands, and they get a CAT scan. The CAT scan of the abdomen reveals an acutely inflamed appendix. It's dilated, it's got edematous walls. He's taken to the operating room, and he's started on cefazolin. Now what they tell you is, the appendix comes out without a problem, but 2 hours later in recovery, he has a heart rate of 120, his blood pressure drops to 85/50, and his temperature is 101.5 degrees Fahrenheit. He has flushing of his skin, but then they tell you give him IV fluids, you give him some antipyretics like Tylenol or acetaminophen, and he improves quickly. The next thing they tell you is that blood and urine cultures are negative, and he's observed for the next few days and nothing grows out. Which of the following is the most likely diagnosis? Is it E, dehydration, viscous perforation, C, malignant hyperthermia, B, the Jerax Herxheimer reaction, or is it acute self-resolving sepsis? Wouldn't that be wonderful if we could have acute self-resolving sepsis? Now, all of the physical findings that were mentioned before, all of them fit with appendicitis. Right lower quadrant pain, starting in the umbilicus, moving towards that side, a positive Rovsing sign. But do you remember, I just sort of, casually said, rash on the palms and soles of your hands. While you're studying, a lot of times we glance over something, we're like, oh yeah, rash on the palms and soles. You read over it quickly, but you have to think, what was that from? Also, he got a dose of a cephalosporin, he had his surgery, and then a few hours later this happened. What is going on here? Well, this is a classic presentation of someone who has a Jerax Herxheimer reaction. Jerax Herxheimer reaction occurs, as you can see here, here's the facial swelling and the rash that can occur with it. Here it is again, the rash that can occur. And basically what it is usually occurs 1 to 2 hours after the treatment of syphilis with antibiotics, especially either penicillin or cephalosporin. This person's palms were having a rash because they had syphilis, but he didn't know. He had recently emigrated, he was from another country, he hadn't had appropriate medical care, and the USMLE will frame it that way so that you don't assume anything about the patient. And notice, his symptoms began 1 to 2 hours after getting that perioperative dose of cefazolin. The reaction itself is caused by pyrogens that are released from the spirochetes when the antibiotics cause them to rupture. It is actually most common during the treatment of secondary syphilis. About 70 to 90% of cases occur during that time, which is again characterized by a rash on the palms and soles. And the way that Jerax Herxheimer reaction presents is with fevers, chills, sweats, headache, hypotension, worsening of those skin lesions that we saw pictures of. But what's beautiful is that it usually resolves within 24 hours of getting treatment with just like fluids and antipyretics. The Jerax Herxheimer reaction looks like sepsis, but it gets better on its own. Remember, it is due to spirochetes blowing up from getting antibiotics from untreated syphilis, most classically, secondary syphilis. Now, thanks for joining me on this case. This is our holiday edition. Who doesn't like to talk about syphilis on the holidays? For those of you tuning in and listening through, this is like a Marvel movie. At the very end of the movie, there's a little bit of a extra dash of amazingness. Now, there's no Spider-Man here, there's no Wolverine or X-Men, but what here is our holiday discount code. That's right. Here at Medquest, we want to wish you a very, very happy holiday with you and your loved ones, and we want to give you 50% off everything on our website. Everything. With the holiday promo code, HOLIDAY50. So when you're checking out, type in HOLIDAY50 and enjoy 50% off on all of us here at Medquest. We love you. You're the reason we do what we do. And thanks for joining me.